ever wondered why are we the way we are? Why is our hair color black? Why do I look different from everyone? Why is skin complexion naturally tanned? Those are the questions often asked by real kids to their parents, asking why they are built in such manner. And we can answer that query by looking deeper on ourselves and deeper meaning going beyond what our naked eye can see. Come on, Reigne, it's only 5 in the morning. Why are you calling so early?
Guys, can you help me? I just woke up, but this project from my biology class is stressing me out. I've been working on this since last night, but I really can't think of a way to start. We're currently on the gene therapy discussion and I need to make a concept out of the topic.
Well, I guess we can help you with that. Jayrren, do you still remember the movie we watched together before? The cystic fibrosis patients that turned into lovers. What do you call that movie again?
Yes, the movie 5 Feet Apart. That movie is a really good one, but it's a tearjerker. But you can definitely make a movie review about it since it is very related to your topic, gene therapy. That movie is about two young people who were suffering from cystic fibrosis but then fell in love with one another. However, they were forced to stay away from each other because of their disease.
To be honest, I really hate tragic love stories, but it seems like a really good movie. If it will really help my project, then can you please tell me more about it? Because I don't have much time to watch it anymore.
Well, the characters of that movie are portrayed by Hailey Lou Richardson as Talban and Cole Sprouse as Remo. So both characters suffer from the genetic disorder and life-threatening cystic fibrosis which affects their lungs. In that movie, Stella tries to battle her illness using social media by educating people on how it affects patients, while Will throws caution to the wind as he believes that they are living in a borrowed time and he prefers to make the most out of their short lives.
Then, why is the movie called 5 Feet Apart?
Since they are cystic fibrosis patients, they are kept to stay away from one another at least 6 feet apart due to the possibility of contracting infections and virus, and that became a big hindrance to Stella and Will when they fell in love. But since they love each other, they decided to take it up a notch and break the rule that instead of 6 feet apart from one another, they made it 5 feet apart.
Well, unfortunately, they still needed to stay away from each other at the end of the movie because their condition would get worse if they still insist to be together.
Well, that's really a tragic love story. But Kheanna said that cystic fibrosis is an incurable disease. How is that related to gene therapy?
Actually, gene therapy is still in the process of being developed as a novel treatment for cystic fibrosis. However, there were some significant changes and some significant promises that were shown with using gene therapy, not just for the treatment of cystic fibrosis but also for other genetic diseases. Another thing, Reigne, is that gene therapy is really advantageous in a way that it can work with any persons with cystic fibrosis despite the mutation that they had. However, it cannot really actually help organ diseases that have already occurred, meaning if gene therapy is targeted on the lungs, it cannot help the cells in the digestive system.
One treatment being developed is RNA therapy. Genes are composed of a series of DNA instructions to make a protein. However, the cell does not use the DNA directly. Instead, the cell makes a working copy of the gene using ribonucleic acid or RNA and uses that working copy to build the protein. If successful, RNA therapy would either replace the faulty messenger RNA with a new mRNA to correct instructions or repair the defective RNA. The advantage of RNA therapy is that there is no risk of disrupting a person's genome. Using RNA therapy also makes it easier to control the dose. However, the disadvantage is that the effects of RNA therapy only last for a very short time, such as 1 or 2 weeks. So this would mean that the patient would have to get repeat doses of therapy to see improvements.
There are also therapies being developed called integrating and non-integrating gene therapy that would help cystic fibrosis patients. In integrating gene therapy, a piece of DNA that contains a correct version of the CFTR gene would be delivered to an individual's cells. The new copy of the CFTR gene would then become a permanent part of their genome, which is the entire set of genetic instructions that is in every cell. This kind of gene therapy is similar to binding a new page into an existing book. An advantage of an integrating gene therapy is that it is permanent. This means that the person with cystic fibrosis might have to receive the gene therapy only once or a few times in his or her entire life. A disadvantage is that the new copy could be inserted into a part of the genome that contains some critical informations, like the new page being randomly added to a book and disrupting an important chapter. This means integrating gene therapy could have undesirable side effects, such as increasing the risk of cancer. Lastly, in the non-integrating gene therapy, a piece of DNA with a correct copy of the CFTR is provided to an individual's cells, but the DNA remains separate from the genome. This is like placing a new page between the covers of an existing book without permanently attaching it. Even though the gene therapy does not become part of the genome, the cell can still use the new copy of the CFTR gene to make normal CFTR proteins.
I guess that's it, guys. Those informations are enough to finish my project. Well, I should continue working on it now. Thank you. It's really a big help. Bye.